It is certainly an exciting, gratifying time to be treating patients with CLL with new therapies and new combinations that are highly active. At UCSD, we are excited to be developing a therapy of our own as well, a drug called sermtuzumab. This is a monoclonal antibody that inhibits a protein called ROR1, or ROR1, which is an orphan receptor kinase that is expressed in CLL cells, but thought not to be expressed in normal tissues, not normal B cells or normal adult tissues. We have been completing a phase 1 trial and are now initiating a phase 2 trial to combine this with ibrutinib for treating patients with CLL or patients with mantle cell lymphoma. Sermtuzumab is something that we're very excited about at our institution. We're eager to see how it works and helps patients with these diseases, and we'll certainly look forward to working with other institutions to further this. Ublituximab is a new engineered anti-CD20 monoclonal antibody. It was tested in combination with ibrutinib for patients with relapsed and refractory disease. Jeff Sharman presented and published these results last year. Their study did show that the combination of those two drugs led to a high response rate, higher than reported with single-agent ibrutinib, albeit at a fairly early time point, I believe at the 6-month point. Some may question whether this simply means that that the combination led to responses sooner, that many of patients with ibrutinib that aren't in a PR by 6 months are headed towards a PR once they clear the treatment-related lymphocytosis. However, regardless, I think that combination of ublituximab and ibrutinib did show that they get more rapid and remissions and a high response rate. Selinexor is an inhibitor of XPO1 or exportin-1. This is a molecule that is involved in transporting proteins from nucleus to cytoplasm. When overexpressed in CLL or in lymphomas or malignancy, it's thought to export some tumor suppressor genes such as TP53 and therefore lead to their inactivation. Some groups, including the group at Ohio State, have also shown, interestingly, that overexpression of exportin-1 leads to other ways to activate the B-cell receptor signaling pathway. So based on this, selinexor is in a few clinical trials, including trials for patients who have progressed on ibrutinib and trials for patients who have had Richter's transformation. I understand that some of the early data from that trial did show activity in that group of patients who have large unmet need.